An associate professor of anesthesiology at the Larner College of Medicine was recently awarded a nearly $2 million grant to study anesthesia-induced hypotension. And here to tell us more about his work is Dr. Emmett Whitaker. Thank you so much for joining us.
Thank you for having me.
So talk a little bit about your research. In layman's terms, what exactly are you studying?
Sure. So in the operating room, low blood pressure is always something we're concerned about when patients are anesthetized, because blood pressure is one of the things that determines whether or not the organs are perfused. It appears that those that are very young, so neonates and infants, and also older adults, those greater than 70 years of age, tend to have a higher risk of anesthesia-induced hypotension or low blood pressure. So this research that'll be performed over the next 5 years, potentially more, hopefully more, will look at what's different about the blood vessels and how they sort of determine whether or not patients are hypotensive, they have low blood pressure, and how that affects whether or not organs get sufficient blood supply.
And what motivated you to look into this? What's the danger for these patients?
Yes, so we're always looking to maximize safety for patients having surgery and having general anesthesia. And so I was motivated to do this research to improve safety for patients, to make sure that our anesthetic agents are not only keeping the patient asleep, but also are being safely used. And so we want to identify low blood pressure. We want to identify the blood pressure at which we should be considering it low. And by doing that, we can optimize organ perfusion or organ blood flow to ensure that the kidneys, the heart, the brain are all functioning just as well after surgery as they were before.
And how do you hope your research will benefit the community, both, medical professionals and patients? Obviously, it sounds like patient safety is the big one, but will other people take this research and then, run with it further?
Yeah, so I think that identifying target blood pressures for the perioperative period, or the period before, during, and after surgery is something that is relevant to all people that are stakeholders in the perioperative care of patients. So surgeons, anesthesiologists, critical care doctors that might take care of patients after surgery. We're all interested in knowing what the right blood pressure is. So not too low, not too high. And this research will form the foundation for understanding not just what those numbers should be, what the blood pressure numbers should be, but also when we should treat blood pressure and what we should treat it with.
And how will this funding help your investigations, your research moving forward?
So I'm a relatively young investigator, kind of at the beginning of my career, and this funding mechanism from the NIH is designed to fund my lab and my research pursuits for the next 5 years. And without this funding, there's no way I'd be able to have the time and the funding to actually perform the research itself. As a clinical anesthesiologist, I spend a lot of my time in the operating room, but in order to spend time over in my lab, I need to have support for that time out of the operating room. So this grant will really go a long way to allowing me to spend the time in the lab to answer these critical questions, as well as having the funds necessary to actually acquire the equipment and materials needed to perform the research.
And so then what are your next steps?
So next steps is to hit the ground running with this research program. And of course, as physician scientists, we're always looking for additional funding. I also perform a good deal of clinical research as well, and we try really hard to make our clinical research complementary to the preclinical research we do in a laboratory, for example. So the clinical studies that I'm pursuing actually look for alternatives to general anesthesia while we answer these critical questions with regards to blood pressure and organ perfusion.
Good luck with that. Thank you so much for your time.
Thank you very much.